the nasolabial folds. And as we get older, we lose the fullness in the cheeks. And when we lose the fullness of the cheeks, the fold becomes more noticeable. And where you used to have high cheekbones, you lose that effect. And instead of using a temporary filler, in under an hour, we injected fat into his cheek. He had it done under local, and then he drove 3 hours home.
And this is the after.
This is him 1 week later.
And once that is done, it doesn't need to be injected again?
It's the fat that you inject is permanent.
Now,
some of the fat will be absorbed, but the majority of the fat will stay, and then that fat will stay for the rest of the patient's life.
And are more men opting for these sorts of procedures every day?
Yes.
What are they commonly having done?
Well, we do a lot of facial procedures on the men, facelifts, eyelid surgery, endoscopic brow surgery. We do a lot of ultrasonic liposuction of the chest, abdomen, and love handles, and quite a number of nose jobs on the patients. They're finding it more acceptable.
And injectables are another hugely growing part of the field, yes? We just
That's
saw
correct.
Injectable fat, but there's all sorts of injectables.
Yes, you can inject different types of fillers like Restylane or Radius or Juvederm, which are temporary fillers and work very nicely. The beauty about it is you can come in and within 5-10 minutes have those injected, and there's typically no downtime. And then there's other things that can inject like Botox or Dysport to rejuvenate someone's face.
So what do you see happening in the next 10 years in this field?
Well, new techniques are always being developed all the time. Fat cells is a tremendous new technique, or relatively new technique, that is going to see more development in that field. The surgeries are more and more less invasive, so recovery is quicker, downtime is minimum. And when you and discomfort, post-operative discomfort, is also significantly less. So when you combine all those, plus the results that the patients are getting, a lot of people look at plastic surgery now as something that, as an option that they would like to consider. We
talked at the beginning of the half hour about Chinese foot binding and corsets and other things that have been done over time in other cultures. You don't see the American culture shifting away from this emphasis on looks and enhancing them through surgery.
Well, currently there has been shown to be pretty popular, and overall the patients have been very, very happy with the results.
And you're happy with your work?
Oh, for me, like I said, it's not my work, it's my love, it's my passion, I enjoy, it's my hobby.
Okay, well, very interesting to talk about and to look at all the pictures. Thanks for being with us, Dr. Halpern. We appreciate it.
Well, thank you very much.
To learn more about Dr. Halpern's practice, you can visit drhalpern.com. This episode of Up Close may be viewed in its entirety at wedu.org. Thanks for watching. I'm Cathy Unruh, and I'll see you next time on Up Close.